వెల్కమ్ టు ఆర్టీవీ. నేను మీ శివరామకృష్ణ. క్యాన్సర్ అనే మహమ్మారి మనుషుల మీద అనేక విధాలుగా దండయాత్ర చేస్తుంది. అందులో భాగంగా ప్రస్తుతం చిన్నారులకి ఐ క్యాన్సర్ కూడా వస్తుంది. ఐ క్యాన్సర్ ఏంటని అనుకుంటున్నారా? అసలు ఐ క్యాన్సర్ ఏంటి, అది ఎలా వ్యాపిస్తుంది, దాన్ని ఎలా అరికట్టాలని చెప్పి మనం ప్రముఖ ఐ క్యాన్సర్ స్పెషలిస్ట్ నేహా గౌస్ గారు మనతో పాటు ఉన్నారు. ఎల్వి ప్రసాద్ ఐ హాస్పిటల్ సంబంధించిన నేహా గౌస్ గారు. మేడం, గుడ్ ఈవినింగ్ మేడం. హౌ ఆర్ యూ మేడం?
Good evening, sir. Namaste.
Yeah, madam. How is eye cancer detected actually?
So, eye cancer can be of various different types. It can affect various parts of the eye, starting from the outside of the eye to all the way inside and behind the eye as well. So, there are various symptoms and signs of eye cancer. So, because we are celebrating Retinoblastoma Week and also because we are promoting Whiteathon, so primarily I will talk about eye cancer in children, which is retinoblastoma, which is the most common eye cancer in children. So retinoblastoma, the most common feature or the sign that comes across is a white reflex or a white glow inside the child's eye. So generally when we take photographs of children or we take family photographs, sometimes we might notice that there is a reddish colored reflex that comes when we take photographs. That is normal, but if something looks abnormal to us, like white color within the child's eye, then that is something that you should get investigated. Go to the ophthalmologist and then get it investigated. It might be an early sign of eye cancer.
Madam, what is the age of eye cancer?
So specifically, if you're talking about retinoblastoma, it can affect children under the age of 3 to 5 years of age. It usually affects very, very small children. So it's something that we need to be aware of and parents need to be aware of. They need to bring their children for regular eye examinations.
Madam, what are the precautions we take to avoid the eye cancer?
So precautions, it's not always possible to completely prevent it. It is, however, definitely possible to detect it early and also treat it early. But some precautions that we definitely can take is that if there is any history amongst family members, any history amongst parents, close relatives, siblings having similar problems in their eye, then the child should get screened urgently and at very periodic intervals.
Why this prominently seen in children, madam?
So this is a genetic condition. It is something that shows up in children more commonly. Why is this particular genetic condition seen more in children? That is not something that we can explain. Different types of eye cancers happen at different ages, but this particular one, retinoblastoma, occurs in children predominantly under 3 years of age.
Yeah, madam, is this any hereditary?
Yes. So retinoblastoma is definitely hereditary. And if parents or any one of the parents also has retinoblastoma, then there is a chance that the child can develop it. So it's extremely important to be aware of this fact. And genetic testing is also available. So that is also something that we promote that parents get done, so that we have an idea of what is the chance that the child can develop eye cancer.
Madam, what is the latest technology to prevent the eye cancer nowadays?
So latest technology to prevent it, there are multiple studies going on. We can also test within when the child is very young, like as soon as the child is born. In newborns also we have to examine the child, and there are various tests and screening studies that are going on that actually so blood tests and even tests from within the eye, but those are not in practice. That is just being researched. So that is not something that we tell the children or the parents. Something we tell them is just to come to the ophthalmologist and get screened. That is the most important thing at this point of time, but there is a lot of research going on still.
What are the recommended treatments to prevent the eye cancer?
So the recommended, first of all, it should be done by an trained ocular oncologist. The recommended treatment, it's variable. It depends on the stage at which the child presents to us. So if the child comes very early, then we can treat it in a minimally invasive way. We can use lasers, we can use freezing therapy. There are various types of chemotherapy available. there is radiotherapy, and of course, ultimately, if it is extremely advanced stage, then we might have to remove the eye as well.
Madam, what are the different types of the cancers?
So that's what. So, like I said, there are multiple types of eye cancers that can be present. They can involve the eyelids, it can involve the surface of the eye, the conjunctiva, the cornea as well. Okay, we can have cancers within the eye, and we can have cancers outside the eye also. So, outside meaning behind, we cannot see it, but the eye gets pushed forwards, and that is another.
Yeah, madam, usually the kids, no, madam,
Yes.
before the delivery, what type of precautions the mother will take?
So it's important. There is something called consanguineous marriage. That means that when there is a marriage within very closely related families, that is also a high risk for developing these genetic conditions, especially if both those families have that same kind of genetic alteration. So that is something that might help prevent cancer of any type, or any other genetic abnormality, that the marriages should not happen in very closely related families. That is one precaution that can be taken.
No, madam, any latest technologies from central government?
No, we don't have anything that can prevent it at this stage. That we don't have. But of course, research is always going on, but we don't have that at this stage.
Almost the parents, they don't know what is the eye cancer
Right.
right now.
Yes.
What type of suggestion about that?
Just that be aware, anytime you feel like there is a problem, there is no harm going to your local ophthalmologist. Just take an opinion, and of course, if they detect anything abnormal, they will refer to the appropriate doctor. So don't hesitate, just immediately go to your the particular eye doctor in question.
How will they find actually the eye cancer? Because the children are very
Yeah, right.
kids, no?
Yes, so that's what, like how I said, the white reflex, that is something very specific, very something that should immediately raise concern. So, white reflex, and there's something that is squint, or when the eye moves outwards or inwards, it's not looking in this in the same direction, both the eyes. That is also one feature of that can be indicative of eye cancer.
Actually, in small age, it's
Yes.
preventive or it's curable, madam.
It's absolutely curable. Children grow up after treatment having completely healthy lives, completely normal lives, but it has to be detected early. That is what we have to stress upon. It has to be detected early.
Madam, actually, what are the difference between the normal cancers and eye cancer? There's a difference. Some breast cancer and stomach cancer is there. A lot of cancers is there. No?
Yes.
What is the difference between the eye cancer and
So the difference, do you mean in terms of treatment, or do you mean in terms of the
Both,
disease
both.
itself?
Yeah.
So eye cancers, it's specific because it originates in the eye, of course, but it can spread. It's not like it's only in the eye, only affects the eye. It can spread to the brain. It can go to other parts of the body through the lymph nodes, through the blood. So it's something, and of course, it affects vision. That is the most important thing. So when if children are small, they will not be able to say. But if you are an adult and you are having any sort of eye symptoms, then you should, of course, get yourself examined, because it could be anything. And of course, eye cancer comes into one part of the diseases that you can have.
Madam, the children before born, what type of suggestions from your side?
So general, it's not like I said. So it's a genetic condition. So if the fetus inherits that specific genetic mutation from either one of its parents, then ultimately there is a chance to develop this particular retinoblastoma. So it's this prevention actually starts even before conception of the fetus. It starts at the time of marriage, okay, and of course during pregnancy. Like in any other case, we always say a healthy lifestyle is important. That's about it. No drugs or any medication is possible at that stage to prevent it, but early detection is what we stress upon.
Yeah. Madam, actually, what is the age before, after born? Is there any age?
They can have it even within a very few weeks of, like within the second week of birth also, they can show signs of having retinoblastoma. Even in utero. That is, even during pregnancy, they can develop it and then it can show up after birth.
And what about the old age persons?
Yes.
Is there any chance to come the?
Yes, retinoblastoma does not usually come in elderly or older age people,
Yeah.
but other cancers like choroidal melanomas or cancers of the eyelid like sebaceous gland carcinomas, squamous cell carcinomas, basal cell carcinomas, these are all names of course, but these are all eyelid cancers. Any different coloration of the eyelid or even eyeball moving outwards, difficulty in movement of the eyeball or double vision, all of these things can also indicate that there is a mass growing somewhere. So, like everyday activities, you're saying?
No. Actually, parents of father smoking and alcohol.
Yeah.
Is there any main reasons to come to these?
Yeah, so see, genetic mutations, we have not got an actual causal relationship. This is what we call a causal relationship, meaning we are doing something and then due to that something is happening. That relationship has not been established, but there is always chance to believe that having a more healthy lifestyle, avoiding smoking, all of those things can obviously prevent a second mutation or a mutation in the genes, which can eventually lead to any disease.
Madam, from finally, tell any suggestions about this eye cancer?
So my first and only suggestion is get your children screened regularly, annually, get yourself screened, be aware of this condition and lead a healthy lifestyle, and also just be like open to suggestions from from people who from your doctors, from your ophthalmologists, and don't be scared about it. Just go ahead with the treatment that is suggested, and that is the best possible way forward.
Madam, finally, thanks for your valuable suggestions, madam. ఇది ప్రముఖ ఐ క్యాన్సర్ స్పెషలిస్ట్ నేహా గౌస్ గారు మనకి అనేక సందేహాలు మన నివృత్తి చేశారు. దీనికి ఇది ఎలాగ క్యూరబుల్, దీనికోసం అసలు భయపడడం అవసరం లేదు. కాకపోతే ఎప్పటికప్పుడు మీ చిన్నారులు అయితే మటుకి ఆప్థమాలజిస్ట్ చూపించుకోండి, తగిన జాగ్రత్తలు తీసుకోండి, ఈ ఐ క్యాన్సర్ బారి నుంచి తప్పించుకోండి అని చెప్పి డాక్టర్ గారు చెప్తున్నారు. ఇది ఐ క్యాన్సర్ సంబంధించి విశేషాలు. కెమెరామెన్ సుధాకర్తో శివరామకృష్ణ, RTV, విశాఖ ఎల్వి ప్రసాద్ ఐ హాస్పిటల్ నుంచి.